Next, we'll have Tim Suther, Senior Vice President and General Manager, Data Solutions at Change Healthcare, one of our newest partners in trying to combat COVID-19 and disparities with data. And Tim will tell us about the resource they put together and how they are working with Duke and other partners on making their claims data available for COVID-19 related research. And we at Duke are a beneficiary of that openness. And Tim and following talk by Fan Lee will highlight what we're doing together. So Tim.
Thank you, Michael. Much appreciation to my colleagues at Duke for putting together today's agenda. The topics are inspiring and critical to better understanding COVID. I'd like to begin my remarks with some context. We live in unparalleled times, simultaneously experiencing a health crisis, an economic crisis, and a social crisis. As a result, all our old rules, it seems, are in question. Care is being deferred or outright canceled. Telemedicine use has exploded, as have mental health concerns, and truth about medicine and science seems harder to come by, thanks to a noxious brew of social media, political rhetoric, and some questionable science. Our country needs rigorous research based on real data to understand, track, and control COVID. That's what Change Healthcare and Duke have set out to do. So let me introduce you to Change Healthcare. We're a multi-billion-dollar healthcare technology company. We focus on inspiring a better healthcare system. That's one that has superior consumer experiences, efficient and accurate financial transactions, and optimized journeys to value-based care. We're 14,000 employees strong, NASDAQ listed, and one of the largest independent healthcare technology companies. Our networks generate substantial data, much of which we can de-identify and use to improve healthcare in America. As you can see, we serve nearly all those who provide care and all those who pay for it. Every day, we process tens of millions of healthcare transactions. And last year, we processed at least one claim for nearly every commercially insured person in the United States. And where permitted, we de-identify data using a rigorous statistical process that is independently certified. This data is not based on surveys or tracking of internet behavior or mobile phone location. Instead, it's entered by medical professionals. To be clear, we only de-identify when authorized by contract, and we never release identifiable patient information. Bottom line, this data provides a clear and fluid view of U.S. healthcare, one that's comprehensive, statistically significant, and actionable now. One example where we've put our data to work is with COVID. As you can see, our data closely tracks key public measures, including tests, diagnoses, hospitalization, and mortality. These are 7-day moving averages for Change Healthcare data in orange, and public sources like the CDC and Johns Hopkins in blue. I know you're familiar with these public data sources, so what's different about Change's data? Well, for one, our fidelity is high and our latency is low. Data is consistently received every day and is updated weekly for researchers. Second, this data goes beyond a COVID encounter, for example, including past diagnoses, care, prescriptions, and other history, and soon, social determinants. Finally, the sheer volume of data unlocks deeper insights. For example, the largest observational study I've seen involved 5,700 COVID patients. We now at Change Healthcare have about 500,000. That's about 100 times more than the largest observational study that has been published in peer-reviewed journals. So, Change enables a wealth of COVID-related insight to understand disease progression, intervention effectiveness, and knock-on effects to the healthcare system. For example, you can detect trends with low latency. For example, changes in the positivity rates of tests or changes in hospitalization rates, or identify impacts to those afflicted with chronic conditions and understand whether certain conditions are more susceptible to COVID or not. You can detect changes in prescription activity, including novel off-label uses. You can analyze changes in care volumes and how care is delivered, or explore demographic and geographic variances. It's clear that different parts of the country and different populations experiences COVID differently. We should understand those differences. I can go on. Plus, I know you have great ideas too. So let's turn our attention to how to activate those ideas, and then I'll be ready for your questions. It's said that if you want to go fast, go alone. But if you want to go far, go together. Since we want to go far, Change Healthcare has established numerous relationships with researchers across the United States. That said, the relationship with Duke is among the most robust. Real credit is due to Michael and Warren for their leadership. For Duke, we've provisioned our Elastic Healthcare Analytics environment. This is a secure analytic environment with de-identified data, standard analytics tools, and software that monitors for compliance obligations. The de-identified data includes hundreds of researchable fields, including detailed information from medical and pharmacy claims across a variety of care settings, and soon will include major social determinants. Our governance process ensures focus on disease profiling and progression, intervention effectiveness, and health disparities. Potential projects that you're interested in should be routed through your Vice Dean of Data Science, Michael Pincina. Every day in our country brings another 30,000 new diagnoses, 700 deaths, and about $10 billion in lost GDP every day. Duke and Change Healthcare partnered to better understand and to ultimately help remediate this terrible pandemic. On behalf of Change Healthcare, thank you for the opportunity to speak with you this morning, and I look forward to answering any questions that you may have.
Thank you very much, Tim. This was a wonderful summary of a fantastic partnership that has emerged in the last few weeks, and I'd like to say how grateful we are for the opportunity. And Tim and his team were wonderful responding to a variety of research proposals that we've started sending their way, and they are some are in progress, grants are being written, and I think there is more opportunity. I think one question for you, Tim, and for Fred as well, is around the ability to link the Change Healthcare data with other resources, some of the ones that Fred talked about that he collected at Amazon Web Services Exchange. Is that possible? How easy is it? And so on.
That's a specialty of Change Healthcare. Our role in this partnership is to enable the needed data engineering to be able to connect disparate sources of data together. An example of that is the social determinants of health, which have been critical to address some of the health disparities that have been talked about today. In addition to the data engineering, what's really important about those disparate data sets is that they not only be linked accurately, but they also have the needed compliance controls around them so that we don't inadvertently trip over a HIPAA violation. And that's what this Elastic Healthcare Analytics environment is meant to do.
Hi, Tim, this is Warren. So that was really a wonderful synopsis of everything you've been doing with Change Healthcare, and of course Duke's really benefited from our partnership. So I guess my question for you is, how can we we have a lot of expertise in social determinants of health. Our director of our CTSA, Ebony Bolware, is a researcher in that area, certainly understanding health disparities. We have a number of folks in her division that actually we haven't really engaged in this. So how can we best engage with you?
We're not opportunity constrained here. So use your imagination. The governance process that we've put in place with Michael, is targeted at making sure that we understand how different populations experience COVID. And a critical factor in doing that is linking what happens in the doctor's office to what happens outside the doctor's office. And once we are ready to go with claims linked to social determinants, which will be imminently, we'd love to entertain research projects that help our country better understand the impact of COVID on various population cohorts.
Great, thank you. And of course, we want to bring in groups like NC Care 360, and we've heard We heard about that this morning, as well as the state. And obviously, selfishly, I'd like to make sure that North Carolina is doing the best that we possibly can, and being a national leader in thinking about disparities in COVID research and how we actually turn the curve for everyone.
We'd be delighted to help you do that, Warren.
Thank you.
Well, I'm so sorry to say that we have, as far as moving on to the next presentation, but obviously this is such a wonderful potential. So we'd encourage people to put any comments or thoughts into the chat box, and also to follow up as we can help you all connect. Thank you both very much.